Hi, this is Dr. Girish AC, consultant plastic and cosmetic surgeon. I am heading Curls and Curves Cosmetic Surgery Center, Vijayanagara, Bengaluru. Today I am going to discuss about rhinoplasty. Rhinoplasty is all about correcting the shape of the nose. So any deviation from the normal shape, we are going to correct it. Even it is also called as nose job, also called as nose reshaping. So not only this corrects the altered shape of the nose, but also any breathing problems, breathing obstruction or nasal obstruction. So the cause can be anything. The person may be having these deviations, an abnormal shape, or it may be altered shape. So this can be from birth, but also can be due to trauma or accident. And sometimes the birth defect called as cleft lip nose. And because of deviations inside, the septal deviations called as deviated nasal septum, and also associated with inferior turbinates hypertrophy, there can be an obstruction in the nose. So breathing issues can also be there. So this rhinoplasty tackles both the shape and the function, that is breathing. The various altered shapes of the nose, like long nose, short nose, crooked nose, hump nose, and also the wide nose, the thick tip or the bulbous tip, what we call. So any and all deviations of the nose. So these can be corrected with the rhinoplasty. So today we can see one case of the bulbous nose. We will show you the deformities. So this is thick nose, the thick skin nose, and this is the bulbosity, what we call what we see in the tip, bulbosity, and the width is more. The alar base width is more here. So we need to sharpen the nose here, improve the tip, as well as decrease the alar base here, and also we need to support a lot. We need to remove the fatty tissue here in this case. So usually before rhinoplasty, all the clients will have some apprehensions, and that whether the nose, the rhinoplasty will go wrong or what. So to avoid this or to overcome this, and to make them to able to visualize what can be the outcome, whether that will be suitable to their face post-operatively. To clarify all these things, we take the photographs through DSLR camera from a particular distance in different angles, different views, what we call, and the proper lighting. So after that, we use a 2D software and do a morphing for them. So after the morphing, we show them and we take a feedback from them. So generally, this will alleviate the apprehensions. Rhinoplasty surgery is usually done under general anesthesia, and this is a daycare surgery, that is morning admission and evening discharge. So usually we take around 3 hours generally, plus or minus, maybe ranging from 2 hours to 3 to 3.5 hours, depending upon the complexity of the nose job here done. After the procedure, so they will be discharged same day evening. During the procedure, of course, they won't have pain, and post procedure also they won't have pain, and there can be some minimal bleeding post operatively, but that will be there for just 1 day, and that is a manageable situation. But if they require, they will come back for the aspiration or suctioning of the nose. So this rhinoplasty surgery, everyone will be afraid of whether any scars will happen over the nose. So what we do, the incisions are made in the columella, in the middle part of the columella or in the lower part of the columella, here, the lower part. So which is in the hidden portion, so it won't be visible later. So and also we suture in such a way it fades away over a period. And also we extend the incision internally here inside on both sides, and we modify the internal structures, that is the lower lateral cartilage, upper lateral cartilage, and the nasal bones are in the upper 1/3 or upper half. If the bones are broad, so we reduce them with the osteotomy. So that is fracturing the nasal bones, and we reduce the width of the nasal bones. And at the same time, if the alar flare is there or basal width is more, we reduce them. Once again, the line incision will come very lower down at the junction here, and so that even this is not seen in the future. So there are two types of rhinoplasty techniques. One is a open technique and another one is a closed technique. In this case, and depending upon the requirement, so either we do open technique or closed technique. Any one technique will not suit all the persons, so thereby depending upon the necessity, and especially when the tip work is the necessary, so we need to open up. In this case, there was more of tip work. That is why we have done an open rhinoplasty. We made a small incision, and after that, so we can see the lower lateral cartilages. We have exposed the lower lateral cartilages, and we are going to change its orientation, improvement. It was wide, so we are going to bring it very closer and follow several techniques to improve the tip definition. In this case, we have removed the septum, and we have made use of it for various grafts. So these grafts are made use to support the tip, the columnar grafts, columnar struts, alar rim grafts, the tip grafts. So we make use of it, and sometimes in a few situations where we need the augmentation, means the dorsum, the height is less, so the bridge height is less. In those cases, we harvest the rib grafts. So the rib grafts are made used to increase the height. So now I have finished the rhinoplasty surgery in this case. Her complaints was, or her problem was, the bulbous tip or the bulky tip. So now it is almost narrowed down to the natural level, as well as we have reduced her alar base, which was very wide and which usually increases on smiling. So now it is almost the normal level. It is reduced, and our aim is to even not only to improve the nose, but also to make the nose to fit or suitable for their face. So now more or less the procedure is over. I need to put some splints. So usually we put internal splint and external splint. Internal splint is just to reduce some amount of the bleeding or the swelling that can happen inside. That I will put in a short while. The external splint is to reduce the external swelling, so that, and these splints are removed after 1 week. So now I'm going to put the splints. So this is the internal splint. So this goes inside, and so this is the external splint, so which we put outside. So this is the external splint, and also we have put some plasters here. Usually the majority would expect there the ecchymosis around or the discoloration around the eyes, but usually with us that does not happen, because we take some special precautions to avoid the ecchymosis or the swelling around the eyes. And this the external splint we remove after 1 week, and this client will be discharged today evening. Post rhinoplasty, we usually discharge same day evening. We consider rhinoplasty as a daycare surgery, and there may be some minimal bleeding which stops in the next day evening. After that, if they are facing any nasal obstruction because of clot, which is causing some problem there, so we do suctioning for them to clear that passage, and there will be an internal splint which decreases the little bleeding also, and controls the internal swelling. So they can have the normal food from today evening, and from tomorrow also they can have the food, but preferably the soft diet we advise. And if they have a scope to work from home, so they can resume that activities after 2 days. But otherwise, if they are they are going for offline work, So they can resume that activity after 1 week. So they are called back after 1 week. So we remove these splints, external splint and internal splint, the plasters around the eyes. So there are no stitch removal here. Whatever the absorbable stitches are there, which falls off within 1 month's time. So they can resume routine activities after 1 week. They can go outside, take normal face wash, head bath, everything. There will be some minimal swelling which reduces over a period. So more or less reasonably in 1 month, the majority of the swelling will reduce except some tip swelling. Within 3 to 4 months, the overall swelling will reduce and give them a defined nose. But the swelling will be around 4 to 5 millimeters, only minimal. So definitely they can go out, be social, and they will appreciate the results day by day or month wise, and more or less it's well settled by 3 to 4 months.